Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. Let's get to the point together.
All right, we're here with Amanda Demarzo. Amanda, welcome to the show.
Thank you for having me. This is a pleasure.
Let's start with the same question I ask all guests. Tell us how you got to where you are today in your own career.
So I currently am the Associate Director of Patient Access for the Accreditation Council for Medical Affairs. And how I got here was I trained as a pharmacist, and I also received my Master's of Business Administration with Fairleigh Dickinson University. And I've been in the healthcare space for about 8 years now. And as I was going through pharmacy school and different areas of education, I realized that I had a really strong passion for patients and patient care and patient access. And an example of this is when I was rounding in the ICU, my mentor noticed that I would spend extra time reassuring families who asked me questions and helping them with their needs. And he said, never lose that quality and make sure to hold on to that, because a lot of healthcare providers don't have that as they go on through their career, because they forget that passion that they started their career with. So I use these experiences to bring me closer to the area of patient care and move towards really advocating for patients and moving into this position that allows me to make a bigger impact and make those changes that can help many more people than just me in one medical facility.
Excellent. So let's shift gears to where you are today. Let's talk about what is prior authorization.
So prior authorization is a complex process. I like to call it the dark cloud of healthcare because everyone's a little nervous when it's brought up. It is a process that was put in place to reduce costs and sometimes double check a provider's health decision. So it could be used for medications or services. So services could be something like an MRI or an X-ray or another type of practice that the physician will order. And these medications or services need to go and get approved by the payer. So the payer would be an insurance company, someone who is authorizing that service or medication to get approved so that the patient can get it. So when I say it's double checking physicians' work, they're checking against clinical guidelines that are put together by experts in the field. And then they're also checking that there's supportive evidence that they can use this for that purpose that the physician ordered. And then on top of that, they're also looking at costs. So when they're looking at costs, they're looking at, are there other medications or services that are more qualified or cheaper that do the same thing to bring down costs for the payer or the insurance company or the self-payer processes. So like they try to bring down the cost so it's less expensive for everyone involved. And while it may slow down patient access or delay in some cases, a lot of the time they are bringing down costs also for the patient.
Yeah, and so why is prior authorization important for example, our clients who are payers for commercial self-insured plans, Amanda?
It comes down to cost. When healthcare plans want to minimize excessive spending, this is the way to make sure there is a medical need or a medical necessity for those services and medications. What you're really looking at is making sure that it's what is clinically recommended to show that that person has that disease state or needs that medication, and that there's supporting evidence for it. And it's also going to be cost effective for the insurer or the payer, because if everyone is getting expensive health care, even if it's not needed, it's going to bankrupt the system.
Yeah, so maybe we can break down really briefly what actually happens behind the scenes during prior authorization. So let's say we've got a therapy, maybe it's $1 million therapy. So prior authorization hits on the claim, then what happens? Can you take us through a 50,000-foot overview of that?
So depending on what type of claim it is, it goes through a slightly different process. So services are usually going through and getting approved before the patient has access to it. The medication side, if it's a really expensive medication, sometimes the patients won't find out until they reach the pharmacy, or the pharmacy will get the prescription, say they don't even have that product in stock, and they have to go to a specialty pharmacy. So that's the difference between like services and the medication side. But once a claim tries to get submitted and get approved, they don't always come back and say you need to get a prior authorization. They might say something else. They might say that they need medical necessity. There's different buzzwords around it, but it all leads to the same thing, where prior authorization, or they need to approve this service or product to get the patient what they need. At a really high level, it goes to the provider, and the provider provides that documentation and supporting information to support that claim. So that could be anything from diagnostic tests. It could be how long have you been having this problem. It could be what you've tried before. And there's different things that get involved in that. And that's a very complicated process or algorithm based on what you're needing for that patient. But the physician is going to collect all the paperwork and fill out very complicated and long documents and submit them to the payer. Then the payer has a staff that's going to look through it. It might go through a prior authorization specialist who makes sure that all the paperwork is there. Then it might go to a prior authorization pharmacist, a prior authorization nurse. There's even prior authorization pharmacy technicians, and they all have a play in getting it approved, but they all check for different aspects of the prior authorization paperwork to make sure everything's there, the clinical need is there, the requirements and algorithms were followed by the provider based on the insurance company's wants and needs. And then once it gets through all of the people on the insurance side, it then gets sent back to the provider saying it's good, or they need more information, or it's denied. And then the provider should be getting back to the appropriate parties about whether it was approved or denied. If something is denied, you can also appeal it, which is another process, and that could be a little complicated too. But overall, when there is a denial, there is opportunities to continue to pursue that medication or that service.
Great. Thank you for that broad overview, Amanda. That was fantastic. So you mentioned a lot of players involved, a lot of touch points in the healthcare team for prior authorization. Relative to the process, can you, for someone who maybe isn't in the healthcare team, can you break down who all is involved in the PA process one more time?
The people that are involved in the prior authorization process from a patient's perspective is going to be maybe your pharmacist, definitely your physician, your doctor, the prescriber of the service, the office staff at the provider's office, maybe a nurse at the office, and sometimes they have a dedicated staff. When you go a little deeper than that, when you're looking on the insurance side, they do have a lot of players involved. They usually have someone that's a touch point that just calls for basic information. That's just a prior authorization specialist. They usually just help filling out the paperwork and saying what's needed, but they can't make clinical decisions. Anything higher than that, clinical decisions or collecting important information that's missing, might go to a prior authorization pharmacist, a prior authorization nurse. They also have prior authorization physicians. So in different areas, there might be different needs, and there's also a different requirement in different states. So some states like Kentucky make sure that you have a physician who is checking those claims to match the specialty of the provider who's requesting that service. So it really comes down to state dependent requirements, and then also what the insurance company has on their end.
Yeah, and back to your earlier point, Amanda, I think it's really important to emphasize that procedures, surgeries, any kind of tests, as well as drugs could be part of the prior authorization process. So you and I are both pharmacists and we come from that world, but there's a whole broader view of prior authorization for appropriate therapies.
Yeah, it's very broad. And there's also prior authorizations for medical devices and any type of innovative technology that's coming out in healthcare. It's a really broad field.
Amanda, kind of in closing, for self-funded employers who are kind of shopping for their third-party administrators on the medical side and or the pharmacy benefits, what advice do you have or questions maybe that they should be asking around prior authorization as they involve different carriers potentially to provide medical and or pharmacy benefits to their employees?
For self-funded employers, what I would be asking is what processes are in place to protect the company as a whole. So this could be the prior authorization process, pre-certification requirements, and then I would also be looking at formulary decisions. So that's the list of medications that are approved that don't need prior authorization. So that's a list of medications that the insurance company already decided that they're willing to pay for and they have set co-pays for. So these are the medications that are probably going to be costing a little less, and they're going to have clinical benefit as well. So they are going to provide the care that the patients need, but they're definitely taking costs into account. And you might want to also ask about if there are any relationships or business relationships with the manufacturers of drugs, because self-payers or self-funded employers definitely have opportunities to build these relationships to bring the cost of drugs down. I'm from New Jersey. We have a lot of manufacturers nearby, and when they're self-funded, they make all of their manufactured drugs really affordable for their patients. So it really focuses on getting those medications that they already have a hand in being affordable for their employees. I would also keep an eye on specialty medications. So these are the really expensive drugs, and they've done a really good job of providing benefits for patients who haven't already had therapies available to them, but they can also cost upwards of $30,000 for a month. So you really want to look at how many people would potentially be on specialty medications, what are the prior authorization processes to get those specialty medications in your insurance plan, and then see what there is to try and decide medical necessity or medical need, because if everyone got on specialty medications, I can tell you that it would probably bankrupt the system and it isn't sustainable. You're really looking at trying to make sure that the insurance can support itself and the people paying in can cover the cost of the claims being paid out.
Perfect. Recently, we've been paying a lot of attention to specialty medications here at Apex Benefits as well. There was an article posted recently on our blog about FDA new drug approvals for the first half of 2020, many of which are oncology drugs and many of which, to your point, are 5 figures a month for therapy. So with that, Amanda Demarzo, Associate Director of Patient Access for the National Board of Prior Authorization Specialists, where can people learn more about you and connect with you?
So I'm a really active LinkedIn user. I would be happy to add anyone who wants to be a connection with me. I love networking. They can also find me in the priorauthtraining.org or on the National Board of Prior Authorization Specialists LinkedIn page. Those are the main contact points for me. If you do want to email me, you can email me at amanda@acmainfo.org.
Thanks, Amanda, and thanks for being part of the podcast.
Thank you.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.